The soft food diet is a very specific diet that I've formulated to use with the GI Janelle 1 protocol for gas and bloating, for IBS and SIBO. So in general, what I'm doing with the soft food diet is I'm removing the hard to digest fibers from the food. Now that can overlap with a FODMAP diet, but not 100%. Like for example, avocados are on the FODMAP diet because they're fermentable, but they're soft. I don't keep them out of the diet when I'm doing the GI1 protocol with my patients. Now, the foods that I do think are good to keep out because they can be irritating are the high fiber foods. And that would be things like whole grains, really crunchy foods, things that are just really hard to break down. And that includes the cruciferous vegetables. Unless they're really, really well cooked, then those are still an option. Root vegetables, when they're really, really well cooked, those are a great option because they can be very soft. You've broken down a lot of the fibers, so they're easier for your body to handle. Now, if you react to everything, then I wouldn't worry about it. I would just go through the protocol, because if you tried everything and every diet under the sun and every treatment for SIBO like Xifaxan and all the antimicrobials, and you still have symptoms regardless of what you do, then don't even worry about your diet. Just get your GI1 powder, go through the protocol, and basically what that is pathognomonic of having a yeast overgrowth that's fermenting. So it's really not going to matter what you eat because they're going to use whatever you eat. So what is in the high fiber, hard to digest foods? And again, there's overlap with a FODMAP diet here, but I'm not doing it for that same reason, because I really don't see the FODMAP diet alone actually curing fermentation symptoms or SIBO. It's just a sort of a temporary, you feel better. So if you like being on the FODMAP diet and you feel better, then go ahead and do that. It's going to eliminate a lot of what I consider the high fiber foods, which are whole grains, right, with the roughness around the shell that makes them whole. That's rough on your body. Uncooked vegetables and uncooked hard fruits like pears and apples. So if they're cooked really well, they're okay. If they're uncooked, then they're going to be really difficult for your body to have to process. So you're just trying to make it easy on your body. And legumes, that's another one. And that's a crossover with the FODMAP, because legumes are fermentable. But don't worry, all of these foods we're going to add back in once you're better. Now, the other part of your soft food diet is to eliminate any inflammatory foods. And here's a little schematic of what I consider to be the inflammatory foods: dairy, wheat, eggs, soy, sugar. So for some people, they're going to be reactive to all of those foods. For some people, they're going to be reactive to one of those foods. For some people, none of them will be a problem. But here's the thing. If you take those foods out while you're going through your titration of the GI1 powder, and you're maintain 30-gram high dose for 8 weeks, and then you add them back in once you feel better, you will be able to determine which of those foods are a problem for you and which you can add back into your diet. So I've done other videos on how to add back the fermenting foods and versus adding back the inflammatory foods at the end. But let's talk about during right now. So during, ideally, you're going to keep on the soft food diet, low residual fibers, and you're going to take out all of those these inflammatory foods in that group that I specified here. And now, if you want more details on these levels of the diet, what I've done in my book is I've separated into 3 different categories, right? So for the hypersensitive patient, for the moderate patient, and for the patient who's stronger and probably reacts to everything food-wise. So if you go through that, I've done it for you. I've taken out the inflammatory foods. And the first level, I've taken out the high fiber foods, and then I'm gradually adding them back in. And best case scenario, what you'll do is you'll wait until you're finished with your full dose of the 8 weeks and you're titrating down. And then you'll expand your diet out using the 2 different mechanisms of adding those back in. the fiber foods, adding in gradually to expand your microbiome out to get better alpha diversity, which is what you want because that's healthy, and then challenging the inflammatory foods one by one, waiting 2 days after to see if they're a problem for you. And if they're not, you can eat them. And then specific questions on things like alcohol, moderation. It's not going to set you back if you have a night out and you're enjoying yourself with your friends. You might not be ready for it, but it's not going to set you back. So moderation of those things that we know that aren't really nutrient-based foods, but you can treat yourself. It's not the diet in terms of the protocol that I'm doing is not a major part of the cure. So it gives you more options than you would if you were working with a doctor who does more focusing on, that FODMAP diet and the idea of starving out the fermentable species. I just don't see that working very well. So the diet is really meant to make you feel more comfortable as you go through this. The main thing that's going to interfere with that is if you're eating foods that are inflammatory for you from this group while you go through the protocol, and you continue to eat them afterwards if they're inflammatory for you. But you're going to find that out because you're going to ask your body. Because once you're feeling better, at the end of your 8 weeks of the full dose of the powder, then you're going to challenge those foods one by one. And if your body reacts to them with abdominal pain or constipation or diarrhea or bloating, it's telling you, I don't like that food. So don't eat that food. I mean, I wish I had in terms of food, I wish I had a better answer for that one. But the problem is our foods, right? Especially if you're living in North America. We've altered those inflammatory foods so much. But if you really want to enjoy yourself and eat dairy and eat gluten, then head over to Europe where they have higher standards in their foods, and you will likely tolerate those foods without a problem. So for more information, it's really broken down in my book, but those are the basic things that I'm trying to do with the foods to keep you comfortable and give you the best information you could get at the end of the protocol.